So if you are someone that sits a lot and you're experiencing a lot of stiffness, pain, new things are coming up with your back and you know you got to get up and move more, but you're not sure where to start. Maybe you get consumed by what you're doing at your desk, but just know the more that you are moving through the day, the less back pain you're going to have. In this video today, I'm going to go through a 10-minute Pilates routine, something you can easily follow to get up from your desk and give you an idea of what your body needs in order to help the back pain and stiffness. My name is Dr. Dawn Andalone. I'm a women's health physical therapist and back pain specialist. And teaching Pilates over the years and also seeing a lot of patients under the realm of having back pain and trying to recover from that and finding something that works for them in a holistic manner, I have found Pilates-based exercise is truly the key to being able to help their body be supported in their spine by strengthening and stabilizing the muscles around your back and working on their flexibility and movement. And this has so much carryover into their daily life. So why does your back pain stiffen when you are sitting for a long period of time? And what can you do to help it? That's a simple little routine. So as you can see on my spine model here, if this is your pelvis at the bottom, you have your lower back vertebrae here, and between each vertebrae you have a disc. And those discs are fluid filled. They're made up of water. And if you're not hydrating enough, that is the number one thing that can start helping ease some of that achiness in your back. If you are dehydrated at all or you're not drinking enough fluids, you definitely want to have water sitting there at your desk and drink throughout the day. Now also, movement is the key. You want that blood flow and circulation going through the muscles and the joints. When you are sitting in a static position for longer than 20 to 30 minutes, your muscles have to do a lot more work to stabilize and hold you there, so your back doesn't get a lot of compression on it. Well, working on the right exercises and working on core strength and postural strength, you actually will take less stress off of your spine by getting those muscles to support you in a better way. After the age of 35, your discs in your back start drying out. Those spaces get more narrow. When you're sitting, this provides a lot more compression on your spine, especially if you don't have some kind of back support. So that is the other tip. You want to make sure that you have something like a small pillow rolled up or a back support that is giving your muscles a little break so they don't have to work so hard to hold you there. Now, what can you do in regards to exercise? Well, if you're working in an office, make sure you're getting up and walking to get water or walking around, taking a lap, setting a timer at your desk for every 20 to 30 minutes that you're getting up and moving. Sitting longer than 30 minutes puts a lot more strain on your back. And over time, this is going to cause more back pain and stiffness and starts to put more compression on your discs and your joints in your back, creating other problems like sciatica and unwanted disc issues down the road. So I'm going to take you through a few simple exercises that you can take a break from your desk and do, and they may provide you some relief and also just give you a routine to follow. So you can do it a few times a day while you're working, either at home or in an office. So here I'm sitting at a desk chair. You can see that if I were all the way back here and I'm at a computer, I'm probably not going to stay there all the time. So if I like to lean forward a little bit, I may want a bigger cushion or something supporting my back in a better way. Now, I would highly recommend, like I said, setting a timer, getting up every 20 to 30 minutes, or doing this little routine a couple times a day from your desk, or just pick one exercise and do it when that timer goes off. So the first exercise is a sit to stand or a squat. In Pilates, we discuss how the core and the breathing and all of that comes from here, your trunk muscles, when you have to move. So you're gonna imagine that you're pulling in and up those muscles deep in your abdominals, but you're not holding your breath. You're just pulling them in and up, and you're gonna get up from your chair. And then you're gonna let your muscles go and then you're gonna sit back down. So it's like a sit to stand or a squat where you're activating your abdominal muscles and your core to kick in before you get up from the chair. So this first one, you wanna do it, repeat it about 10 times. That is the first exercise. It's gonna help cue your trunk muscles to kick in and remind them what they need to do, especially before you move your legs or your arms, and also gets blood flow circulating, helping take tension off of your back. The next exercise we're gonna do is staying in a sitting position. You're going to shift all the way forward in your chair and straighten out one leg. And then we're gonna let our muscles through our trunk go, and this is purely more of a hamstring stretch. So you're gonna lean your spine, your chest forward until you feel a pull down the back of your leg, one leg bent, one leg straight. And you're gonna hold this for a count of 10 to 20 seconds, and then you can repeat it on the other side. You can pull your toes up towards you and make sure you keep that spine nice and long as you bend forward. You don't want to round and hunch forward. We want to keep your chest lifted and lean forward from there and hold for about 10 to 20 seconds, and you can repeat that 2 times on each side. So the next exercise is getting up from your chair and doing some side bending. So we're gonna take our arms straight up and think of your spine growing taller and longer, and you can grab your wrist on one side and you're gonna lean over to the right, opening up that whole left side of your body by your rib cage, and take a deep breath in through your nose and out through your mouth where you feel a good pull all down that left side. And then come back up and do another stretch to the opposite side. Inhale and exhale, so you feel a release in the rib cage and those muscles that go all along your spine on the side there. Then the next thing is very simple, and this can be done multiple times a day, is just checking in with your breathing. So in Pilates, like I mentioned, we talk a lot about breathing because breathing has to happen from your diaphragm, that muscle that's at the top part of your core, and it also helps promote relaxation and also just helps get oxygen through your body. So when we get stressed out or we're using our arms a lot at the computer, we tend to breathe from up in our neck and shoulders. So instead, you're gonna practice some breathing through your ribs, and you can stay seated for this, or you can stand back up. If you're doing a standing desk too, that's another great way to get some relief of your lower back. So when you are breathing, you want to imagine an umbrella opening and closing, like you're breathing into your ribs, halfway here and halfway down into your belly. So you'll take some deep breaths and just check in and make sure that you're not over tensing your neck and shoulders, that you're really breathing through this lower part of your body. You can do about 10 deep breaths like that. No one knows you're even doing it. You can do it sitting in your chair and just check back in. Make sure you're not holding a lot of tension in your inner thighs or in your lower back or in your abdominals. You want to purely just think of relaxing and breathing through that area. Then the next exercise is a spine twist. So we're going to bring our arms straight out in front of us, and then you'll take an inhale, and as you exhale, you're going to open up your chest and you're leaning backward and you're trying to rotate through your shoulders. You don't want to overextend your arm past where your shoulder is. Keep it in line with your shoulder and your chest, but you're purely just twisting from your torso and looking behind you. And then you bring it back and you go inhale, and then you exhale and twist and open to the other side. If your chair is too tall and you can't quite do that, you can cross your hand over your chest and twist there, or you can stand up and try the same thing. But this is a Pilates mat exercise called a spine twist that can be done in more of a modification toward a sitting position or standing. So make sure with any exercise program that you check in with your body. Are you experiencing pain where you can't even get through to that? or you're getting numbness or weakness in the legs, you definitely want to get checked out by a physician and make sure that nothing else is going on. But if you're experiencing that day-to-day stiffness, achiness in your lower back, you definitely need to do more movement, get up and walk, and also go through this little routine. You can do this a couple times a day, or adding in some of your other favorite moves to these 5 or 10 minute little routine. And even if you have a standing desk, you can think about doing these too with some stretches while you're standing, or some little squats as well in a standing desk position. So I hope you learned something from this video. Hit subscribe if you want to learn more about how to ease your back pain and other common women's health topics that I cover here. Thanks for watching.